Everybody, this is Diana. This is Diana Bianca with Artemis Consulting, and I am a facilitator for this community review board. Oh, there's Alyssa. Hi, Alyssa. We're just getting started. If we could pull up the slides, and we'll just do a little overview of what we're doing today and some logistics. So, welcome to the second meeting of the community review board for the Kroger-Albertsons review. Next slide, please. This meeting is being recorded. Closed captioning is available. If you want to make a comment, please raise your hand or the chat feature. You can, as you know, just chat to the host, which is Stacy. But also for the community review board members, you can always wave your hand at me like this, and I will certainly look for that as well. As a reminder, these are public meetings, and if we go to there, public can attend and view these meetings. And if you want to provide public comment, you can email hicmo@oha.oregon.gov. We will put that in the chat as well. Stacy or somebody could do that just so folks have it. And if we go to the next slide, we'll do introductions in a moment. So I'm still seeing that first slide. I don't know about oh, there we go. And just asking folks to remain muted until it's your time to speak. I went over some of that. And if we go to the next slide, going to talk about what we're doing today, and then we will do introduction. So really today, last time we spent a lot of time getting grounded in the program and the role of the CRB. Today is going deep on the transaction and how it might impact communities and folks in Oregon. And so the slides were sent out in advance. There's really going to go into the HCMO, other regulatory review processes, pharmacy landscape, why consolidation matters, how might the transaction impact Oregon, and then what I'd ask all of you, the CRB members, is as you're listening, so a couple things. There'll be opportunities for you to ask questions for clarification, like, I don't understand that, can you say a little bit more about that? And at the same time, when you're listening today, please do be jotting down questions that you have, things you're concerned about in general, but particularly in preparation for the public hearing, which we're going to hear about in a moment. So we will have time at the end of our 2 hours together to really hear your questions, but please do be writing them down. Next slide, please. This is about the public comment. So these are ways the public can submit public comment about this transaction or any HCMO transaction. So let's do quick introductions so we can go to the next slide, please. Just again, because these are public meetings and you all are still getting to know each other, let's just go around and I will go down the list that I have. David, could you introduce yourself, please?
Sure. My name is Dan Kennedy, and I'm a pharmacist, a retired pharmacist. Excuse me. Also president of the Oregon State Pharmacy Association.
Thanks, Dan. Let's go to David.
Thank you. Good afternoon, David Hill. I live in Springfield, Oregon. I use he, him pronouns. And I'm sorry, what did you want to know? Just introductions?
That was it. It's just perfect. Introductions. You're good.
Okay, thanks.
Kevin.
Hi, my name is Kevin Knutson. I am a pharmacist for a company called High School Pharmacy, although I'm not here to represent them. I'm here of my own doing. I use he, him also.
Thank you. Laura.
Hi, Laura Johnson, she, her pronouns. I'm here representing SEIU Local 49 and 503. We represent about 10,000 workers across the state.
Thank you. Craig.
Hi, everyone. Craig Newton. I live in Medford, Oregon. I've been volunteering 8 years at Jackson Care Connect down here. I'm the chairman of the board for both the CAC and the board of directors. Thank you.
Thank you. Alyssa.
Hi, everybody. Alyssa Pennicook, Medford, Oregon. Primarily stay-at-home mom these days, but background in employee benefits and project management and human resources.
Thank you. And Jeanette. Jeanette, I think you're with us, but you might be on mute.
I'm here. Sorry
There
about
you
that.
go. All good.
I am Jeanette. I use she, they pronouns, and I have a background and a passion and a background in rural healthcare.
Thanks. And I think I got everybody. Thank you all for being here. If we go to the next slide, we'll just do a reminder of who we are. Bianco, I use she, her pronouns, and I am a consultant facilitating this process. Stacy.
Hi there, my name is Stacy DeLong. I am a policy analyst with the Oregon Health Authority, she or they pronouns. Jenny.
Hi, my name is Jenny Gredis. I'm a policy advisor for OHA, work on the healthcare and market oversight program, and I use she, her pronouns.
Great. Thanks, everybody. So we're going to just dive right in. Does any CRB members, any questions on the agenda? All right. Stacy's going to start us off to talk about the public hearing.
Thanks, Diana. So next slide, please. Last week, you'll recall that you decided to move forward with holding a public hearing. So the public hearing is scheduled. It's going to be April 24th from 1 p.m. to 3 p.m. Pacific. It's a Zoom meeting, so a virtual meeting. The proposed agenda that we have is for OHA staff to provide high-level information about our review and the proposed transaction. We will have time for representatives from Kroger-Albertsons and CNS to provide testimony or a statement. And then we'll also have Q&A with representatives from Kroger-Albertsons and CNS. And we will also have time to hear public comment and testimony. The community review board's role in this meeting will be attending the hearing, listening to what is stated. OHA will ask the questions of the entities, facilitate the meeting, and moderate the public comments. We would also like to have a CRB member provide a brief opening statement at the hearing. OHA can support and help draft the statement. Really, we're looking for somebody to say what the CRB is, talk a little bit about the purpose of the hearing, and really just open everything up. So if you are interested in providing this opening statement, you can email me and Jenny. And then if we have multiple interested members, we can essentially just draw a name out of a hat to see who would like to do that. And as we talked about later, well, as we have in the agenda later in this meeting, we'll talk a little bit more about questions for the entities for the public hearing. So we're going to hold time for that after we do kind of provide a bunch of information. Next slide, please. This slide is just showing an overview of the outreach we'll be doing for the public hearing. There were some questions last week about it, so we wanted to share this information. We are going to be pushing everything out tomorrow, April 11th. We're going to post information to our website. We're going to put the word out in newspapers. In addition to newspapers, we'll be reaching out to media outlets around the state. We're going to include it in OHA's email newsletters. Oregon Health News has a really broad distribution. Provider Matters is focused on healthcare providers. We're going to put it on OHA's social media. We'll be sending a notification to state and local officials, so elected officials in the state legislature. And then we're going to be sharing it with Coordinated Care Organization Innovator Agents. So these folks work with the coordinated care organizations that serve OHP members in the state. We'll also be sending a notice to providers and health facilities around the state. Any questions?
Jeanette.
I didn't hear mention, I don't see, but I just wanted to touch bases and see if you have any tribal liaisons that you typically work with, or if there's going to be a plan for input from any of the tribes involved in that public hearing process?
Yeah, we will also share it with our tribal liaison at OHA to pass
Okay.
along to OHA's tribal affairs. Thank you. That's a great idea.
Thanks, Jeanette. Are there any other questions about the public hearing? Again, we're going to get about the logistics. We're going to get to the questions. Please, Craig.
Thank you. This is kind of an odd question. It just popped in my mind. What if one of the organizations says, we don't want to attend the public hearing? Do we have a timeline when we're supposed to hear back from the two entities? Thank you.
Yeah, in the meeting materials, we provided the letter that we sent to them. We've asked them to identify who will be attending. We met with them yesterday to clarify what would happen at the public hearing, and they are going to get back with us on who will be attending and their thoughts on what statement or testimony they'll be providing. So we expect to hear from them this week on their attendance. For that, if they tell us they're not attending, we'll be working with our legal counsel to figure out the next steps. Jenny, is there anything you would add to that?
Nope, I think that's what I would say.
Oops. Anything else before we move on, folks? All right. So now we're going to get into just some information about the transaction. And so you'll hear from Stacy and Jenny primarily, and this is a lot of information. We recognize that. We'll have time, note your questions. If you have something burning when it's being presented, let us know. You have the slides. So we understand this is a lot of information, and we want to be sure you have time to digest it as much as possible today. And then there is some time moving forward. And I mentioned that we're going to make sure we have questions from all of you in preparation for the public hearing. We'll also have time after this meeting for you all to provide additional questions. So just want to be sure that you all know that there will be time for you to really digest some of this information. So with that, I think I'm turning it over to Jenny.
Okay, thank you, Diana. So I'm going to start with an overview of the transaction. So if we can go to the next slide. So as you all know, Kroger and Albertsons are planning to merge, and together they have about 5,000 grocery stores across the country. They have 176 stores in Oregon. They are two of the largest grocery store chains in the country. And in October 2022, they announced that they had signed a merger agreement. And under that agreement, Kroger would buy Albertsons for $24.6 billion. And that would include all of Albertsons business, not just pharmacy. And about a year later, they announced that they had made a plan to sell approximately 400 stores nationwide and 49 stores in Oregon to another company, CNS Wholesale Grocers. We're going to refer to that as the divestiture. That's kind of the technical term. The reason for that arrangement was to address potential concerns that regulators might have that the merger would reduce grocery store competition in certain areas of the country. And also want to note that when we talk about the transaction in the context of HCMO's review, we're going to be referring to both parts of this deal. So both kind of the merger piece and then the divestiture or selling of the 400 plus stores to this other company. So moving on to the next slide. So a few stats on Kroger. It's the largest supermarket chain in the country. Nationally, it had revenues of $148 billion in 2022. Operates more than 2,700 supermarket stores in 35 states. Has more than 20 grocery store banners. Or banners are things like the name of the store. So Fred Meyer or QFC, for example, are banners. They employ 430,000 full and part-time employees. And in Oregon, there are 55 Kroger stores. They operate under the Fred Meyer and QFC banners. Most of those stores are Fred Meyer. I think there's about 4 QFC stores in Oregon. And they have about 14,600 employees. Next slide. So Kroger is also one of the largest pharmacy chains in Oregon. Nationally, they have retail pharmacies in most of their stores. About 2,200 retail stores have pharmacies. They also provide other services related to pharmacy, so mail order, pharmacy benefit management, and specialty pharmacy. And I'll talk a little bit about what those things are. But moving to Oregon, out of the 55 stores that they operate, 53 of those stores have retail pharmacies and are located in 20 counties across the state. Next slide, please. Okay, so moving on to Albertsons. Albertsons is also one of the largest supermarket and pharmacy chains nationally and in Oregon. They have revenues of over $77 billion, operate more than 2,200 stores in 35 states with more than 15 grocery store banners. They employ over 285,000 people, and they have more than 1,700 retail pharmacies. They also provide mail order and specialty pharmacy services. And in Oregon, Albertsons operates the Safeway and Albertsons banners. So all the Safeway stores are owned by Albertsons as well as the Albertsons stores. So a total of 121 grocery stores, approximately 14,000 employees, and 106 retail pharmacies across 28 counties of the state. They also provide telehealth services through an agreement with Providence Health. And they lease space to a lab company, Quest Diagnostics, that operates patient service centers in some Albertsons stores in Oregon. Next slide, please. Okay, so moving on to CNS. CNS Wholesale Grocers, they are a wholesale grocery supply company. They supply approximately 7,700 independent supermarkets, retail chain stores, and military bases across the country. They have revenues of about $30 billion annually, and most of their operations are wholesale. So they have a fairly limited retail operation. They have 23 retail stores that they operate across the country, 2 retail grocery banners, which are Piggly Wiggly and Grand Union. And you probably have not heard of those, but you may have if you have lived in other parts of the country. They have about 15,000 employees, and they operate 1 retail pharmacy. And in Oregon, they operate as a wholesale grocery supplier. They have a warehouse in Troutdale, and they do not have any retail grocery store operations or pharmacy operations. So I also want to note that historically, CNS has had a strategy of really being a wholesaler. That has been their main business. And they've had a history of acquiring stores, retail grocery stores, and then selling them off to after they've established supply agreements with the new owners of the store. And in a recent financial report, well, it was from 2021, so a few years ago, they stated that they did not intend to operate retail grocery stores in the long term. And next slide, please. Okay, so just recapping the merger and divestiture terms, Kroger would pay $24.6 billion to purchase Albertsons. Kroger would take on $4.7 billion of Albertsons debt. Albertsons would become a wholly owned subsidiary of Kroger, and CNS Wholesale would pay $1.9 billion for the selected Kroger and Albertsons stores. And they would also buy 8 distribution centers, 2 offices, 3 banner names, including the QFC banner, and 5 private label brands. Next slide, please. So Kroger, Albertsons, and CNS have made various statements in the press and in HCMO filings about what will or will not happen as a result of the deal. And the slide highlights some of those statements. So Kroger has said Kroger will not close any stores, distribution centers, or manufacturing facilities, or lay off any frontline associates as a result of the merger. They, in their HICMO filing, they also said that they have no plans to reduce the scope or types of healthcare products and services offered in Oregon, the number of grocery stores or pharmacies in Oregon, or the types of insurance accepted at its pharmacies. And with regards to the divestiture, CNS has said they will continue to recognize the union workforce, maintain all collective bargaining agreements, and the parties have also said that no stores will close as a result of the divestiture plan. And I want to ask and pause at this point before I hand over to Stacy if there's any questions. All right, I guess I don't see any, so.
I have a question. Sorry, I was still on my buttons there, but I have a question. So it seems like CNS is a bit of a wild card in this divestiture. So I know that CNS will continue to recognize union workforce and collective bargaining agreements, but do we know what their long range plans are for stores? Are they just going to divest themselves of these stores? Or do we know? I mean, it seems to me CNS is kind of the wild card, like we don't really know what they're going to do.
That's a great question, Dan, and I will share some more information on that topic later on in the presentation. So if you don't mind bearing with me, and we can get back to that point later. David?
Thank you. I just had a question. I was looking for a list of the 49 stores in Oregon that were identified as which locations, or how do they identify which stores would be sold? And have they released a list of those stores? Assuming that CNS picks up the QFC banner, we know that those 2 or 4 stores are part of that portfolio, but related to the others, is there a list that we would be able to see? Are they planning to release that at a certain date? Any kind of information that they might have shared about that?
Yeah, thank you for that question. Also a great question. They have not released that list, but that is something that maybe we can discuss as that could be requested as part of the hearing or as a request from the CRB.
Yeah, or if not, the specific locations, just what's their criteria that they're looking at when they're, how are they determining which stores CNS would be acquiring as part of that? If not the specific locations, how do they identify which of the 49 they were planning to let go of?
Yeah, I mean, I can speak sort of broadly to that. They have shared sort of their methodology nationally for identifying which stores are going to be divested. So they've looked at sort of local areas where there's overlap between Kroger and Albertsons and what their market shares are for grocery store sales. So really they've looked at areas where they compete sort of head to head, and the merger would reduce competition if they became the same company, so to speak. So it's based on an analysis of grocery store competition and areas of overlap. That's how they have described that process to us.
Jeanette, I thought I saw your hand up. Sorry, Jeanette, I thought I saw your hand up and then it went down, but just want to check in with you.
Oh yeah, no, I think it just went down, but I did still have a question.
Go for it.
Okay, so actually I have a couple of questions. First, I just kind of wanted to piggyback off of that last question. So I agree. I also would be interested in hearing more about those stores that are already all kind of on the chopping block for divestiture. particularly any equity analysis that has been undertaken, especially because if I have a concern that if the store profile that CNS tends to be is more wholesale, and whether that is the same price point as Albertsons and Kroger, which is typically higher, right? So are you looking at the same economic group, socioeconomic groups? And are they going to be impacted in the same ways, right? And knowing that there are a lot of different factors that impact different groups where, in say the metro area, there is public transportation and there's other resources available that may not be, right? Like those are all unique geographic factors. So all that to say, I would be very interested in the any equity analysis that has gone into it. And then I think just the other question I had was just the oh, and I want to go back to that first question before I lose this train of thought. Also working with the tribes, because I know that can be that much more of an impact when there are limited resources, or you're more kind of rural, or further away from larger grocery stores and pharmacy areas. And then I think just what the vision is for when Kroger and Albertsons, or when Kroger execs say that they have no plan of selling or getting or closing any stores, if that's like this is our 1-year plan or our 5-year plan, or this is our hopes and dreams, right? Like, because that, I think, also is an important driver of the conversation, because without knowing, like, this is our, we have a lot of confidence that it's going to be this way for a while, adds a little bit of trepidation to how to approach it.
Thanks, Jeanette. And I think you all can probably tell that Stacy and Jenny and I are taking notes and capturing all of this. So these are exactly the kind of inquiries that we're going to capture. And as obviously there's some questions Jenny can answer now, like about the criteria, but those that are questions sort of for the entities, we'll continue to capture those. So thank you. Jenny, go for it.
Yeah, no, I just
Thank
wanted
you.
regards to the equity analysis. OHA has done some analysis of that, and we can share that. I don't have that sort of available to share right now, but we can certainly pull that together and share some of that analysis that we've done internally. And I think that's also a great question for the entities to address. I see Laura's hand.
Hi, just hopefully a quick question. So just to be clear, the stores that are divested, have they agreed that they will continue to provide pharmacy services in those stores?
They have not provided. So again, I'm going to get to that later in terms of what we know about that. But yeah, so they've made some statements that they don't intend to close any pharmacies and so forth. So similar types of assurances that we've gotten, but no details.
Okay, got it. Thank you.
Thanks.
Okay.
All right. Stacey, are you ready for your piece?
Sure, let's do the next slide. Okay, so I'm going to talk about the healthcare market oversight review process along with some other state and federal processes. Let's go to the next slide. Okay, so the healthcare market oversight program is reviewing this merger. HCMO regulates transactions involving healthcare entities. So our review is focused on the pharmacy business of these companies. We started our review in August 2023 after the entities filed a notice. We had our 30-day preliminary review period and then went to comprehensive review. The companies have businesses outside of pharmacy. We're aware of that business. But the particular focus is really the pharmacy piece. Our review assesses impacts in Oregon. So we've talked about this as a national transaction, but Oregon is really our purview. We'll be looking at how this transaction affects people and systems in the state. Our review will result in a decision to approve with conditions, or disapprove the transaction. I'll add an asterisk to that if the entities withdraw their application at any point or abandon the transaction, our review would end and we wouldn't issue a decision. Let's go to the next slide. Okay, you saw this slide last meeting. It's here again though, because it's important for our review. These are the criteria that guide our review. They're outlined in our rules. The specific rule is OAR 409-070-0060. So we have two columns here. There's the first column, and for OHA to approve the transaction, it must meet all the criteria in that column under bullet A. And then in the second column, to approve a transaction, the transaction needs to meet at least one of those listed in B or C. So for column A, we have there's no substantial likelihood the transaction would have material anti-competitive effects. And for this criteria, we're looking for material anti-competitive effects in the region that are not outweighed by benefits in increasing or maintaining services to underserved populations. It can't be contrary to law. There's no substantial likelihood it would jeopardize the financial stability of a healthcare entity involved in the transaction. And there's no likelihood that it would otherwise be hazardous or prejudicial to consumers or the public. And then it will benefit the public good or communities by reducing the growth in patient costs, increasing access to services in medically underserved areas, or rectifying historical and contemporary factors contributing to a lack of health equity or access to services, or it will improve health outcomes for residents in the state. Next slide. So I'm going to talk about some of the key questions we'll be covering in our analysis and our review. So it's impossible for us to know for sure what will happen if the transaction proceeds. What we're doing here is essentially developing an informed prediction of the future state, where our review assesses the likelihood of each of the potential impacts that we're listing. We don't yet have all the information we need to answer all of these questions. So that's where we've requested additional information from the entities, and we're waiting to hear back from them. So the first question, will the transaction reduce competition in Oregon's retail pharmacy market? Really wanting to know, how is it going to affect the market? Our second question is whether CNS will be a viable competitor in pharmacy operator. Do they have the financial resources, staff, and expertise to successfully operate the divested pharmacies? We're looking at, will insurance companies and patients pay more for their prescriptions filled at Kroger and Albertsons pharmacies? And will the transaction result in store closures or other reductions in access to pharmacy services? Let's go to the next slide, and the list continues. So we're also going to look at whether the transaction will change the types of insurance accepted at pharmacies. We'll look at whether, will the transaction make it harder to adequately staff pharmacies? We'll look at if the transaction will result in changes to pharmacy services provided, including the selection of prescription drugs that are available, or the availability of other clinical services like vaccinations at pharmacies, and also the availability of other healthcare products like diabetic supplies or medical equipment. We're also going to look at if the transaction will affect some communities or groups more than others. Will it result in any disparities or inequities? Next slide, please. So that's a little about the healthcare market oversight review. This deal is also undergoing review by other state and federal agencies. The Federal Trade Commission is pursuing an antitrust lawsuit to block the merger. They filed the lawsuit in February. 8 states, including Oregon and Washington, D.C., have joined this suit, and Colorado and Washington State have filed separate suits opposing the merger. These actions are largely focused on how the merger could harm competition among grocery stores, and they're going to look closely at whether the divestiture plan adequately addresses the concerns about competition. They're primarily focused on Kroger and Albertsons grocery business. And also know that these actions are separate from OHA's review. We're tracking them. We're reviewing all the public information that's released related to them, but they are separate. Next slide. So this table kind of shows a side-by-side comparison of the healthcare market oversight and FTC purviews. So HCMO's review is distinct in that we're looking primarily at pharmacy and prescription drug business, and our jurisdiction is specific to Oregon. The FTC is going to look at grocery, all the business, and is going to be looking nationwide. When we look at criteria in our focus areas, the FTC is focused on largely looking at competition. HCMO is broader than just competition. We're also going to look at cost, equity, access, quality, and other factors. For the outcome, we will issue a decision to approve with conditions, or disapprove the transaction. The FTC also issues the decision in their review. And then timelines for the FTC, they have an administrative hearing date currently set for July 31st. Our timeline, we have some dependencies for that. We're assuming sometime summer, August 2024. As we've mentioned, we have 180 days from the date we receive a complete notice to carry out the comprehensive review, but we can pause our review clock to request more information. We're currently paused. Given that our timeline depends on receiving information we've requested from the entities, it's difficult to predict exactly when our review will be finished. Okay, let's look at the next slide, please. So as we mentioned, the FTC filed a lawsuit. They had been investigating the merger for over a year prior to filing the lawsuit. And in their complaint, they highlighted some pharmacy concerns. So they mentioned that offering pharmacy services is an important way for Kroger and Albertsons to compete and attract supermarket customers. They compete to win pharmacy patients, retain prescriptions, and offer other pharmacy services. This competition incentivizes them to offer promotions and adjust pharmacy hours and staffing to be more attractive to pharmacy patients. The proposed transaction would reduce Kroger and Albertsons' incentive to continue offering the same level of pharmacy services. So really they're saying that Kroger and Albertsons may be less motivated to offer high quality services that would attract supermarket customers. And Jenny, maybe you could, if there's a public link to the complaint, we could drop that in the chat. Thanks. Okay, let's go to the next slide. This is a high-level timeline. This will give you a sense of key dates. So October 2022 is when the entities announced the merger. In August of 2023, we started the healthcare market oversight review. In September, we began the comprehensive review, and that is also when Kroger and Albertsons announced the divestiture plan. In February of this year, the FTC filed their antitrust lawsuit. We convened this community review board in April of 2024. We expect a recommendation from this board in May of 2024. And then as we mentioned, in summer of 2024, that's the expected timeline for HCMO to complete the comprehensive review. With the note that that is subject to change depending on hearing back from the entities to our request for information. Okay, I'll pause now to see if there's any questions. Okay, I see David's hand.
Thank you. I just had a question. That link to a 32-page document you just posted in the chat. What is this again? What am I looking at?
I think Jenny, you can clarify, is that the FTC complaint, the public complaint?
Yeah, and I apologize. The first link is not the correct one. So click on the second one. It has the word complaint public at the end of it. That's the complaint in where the FTC essentially outlines the concerns that it has about the merger and the grounds on which it's challenging the merger. So that is sort of a public. There's a public version of it which has quite a lot of information. There's some trade secrets and things that are blacked out in that document, but it's publicly available.
Thank you very much.
I see Craig's hand up as well.
Thank you, Stacy. If we all look at May 2024, it says this is the expected recommendation from this board. And then next it says summer 2024, expected timeline for HICMO to complete review. It kind of seems backwards. Here's my question. So we give a recommendation in May. What happens in the summer? Is this possibly, you're saying, if more information comes in that may change a recommendation? Or anyway, thank you.
Yeah, so that would be if the summer 2024 is when the clock kind of runs out on the timeline. So the recommendation, and we had a slide for this from last meeting, but the recommendation is one of the inputs for OHA's decision. So after well, right now, while we're doing this work, we're also completing our analyses. And so after we get a recommendation from the Community Review Board, we would be finalizing our analyses and then drafting our decision in our report. Would be the work that we're doing. If there is additional information or anything materially changes in the transaction, then that would affect that timeline as well.
Okay.
I see Laura.
Yeah, could you go back to the FTC lawsuit slide really quick? This just prompted a question, and again, you might be getting to this later, but something that I'm kind of taking away from this is what is important about the pharmacy business is that it brings customers into the grocery store, and that's like its importance to these businesses. So I'm curious, like, and maybe you know this or maybe you can't tell us, but like, do the pharmacy services make money? Like, is there an incentive, a financial incentive for them to continue to offer pharmacy services aside from attracting grocery customers? Does that make sense?
Yeah, and Jenny, I'm going to punt to you to answer that one.
Yeah, it's a question that we are also looking into and doing some analysis around. But I think that's something that we would ask the entities to speak to. Certainly a great question. But yeah, I don't have an answer for you on that. Thank you.
Let's go to Alyssa, then David.
Hey guys, sorry, my company doesn't really use the reactions. I'm still kind of getting used to them here. But I don't know the legal terms to use, but when Safeway and Albertsons came together, I'm just kind of wondering what review was done at that time, and if we're able to use any of that as part of this, or kind of what all of that looked like.
You're all anticipating all of our material, so thank you for that. We are going to touch on that later on, but yes, that merger happened in 2015, and that was also reviewed by the FTC. So I will talk to you more and tell you a little bit more about that going forward in the next part of the presentation.
Thanks. Go ahead, David.
Thank you. Yes, I thought Laura's question about it kind of relates back to that criteria of do the pharmacies, are they a profitable business? And it sounds like from this slide here that it's used to attract customers into the grocery store. I thought I heard maybe it was Jenny talking about FTC is looking primarily at the grocery component of this merger. Is that correct? Or how much is it weighted in FTC's sort of suit related to the pharmaceutical side of this deal? Is their focus primarily on grocery, or are they taking into consideration the pharmaceutical component?
Yeah, that's correct. And I think that's what Stacy mentioned, is that their review and analysis is focused on the grocery supermarket competition and how that would be impacted by the transaction. But certainly they're not looking at pharmacy in terms of what the repercussions could be for pharmacy services if that competition were to be reduced. I think that's what some of these points are getting at.
Go for it, Dan.
Yes, I would just, answering the first question, I would say that pharmacy services within both Kroger and Albertsons are profit generating departments within the store. So while it's a great way to attract supermarket customers because they're going to buy their groceries or whatever, at the same time they're getting their prescriptions filled, it is a revenue source for these stores. And in terms of competitive nature, it's probably an incentive to have a pharmacy rather than not have a pharmacy in Kroger or Albertsons. So I don't know that one could have a pharmacy and the other not have a pharmacy and be competitive in the marketplace. So I hope that makes sense.
It does. Thank you.
Thanks, Dan.
Yes.
So Stacy, I think you were on that timeline slide.
Yeah, and that was my last slide, so I can go ahead and hand it back to Jenny to talk more about pharmacy.
Okay, thank you so much, Stacy. We are running a little bit behind on time, but I think we're fine because we had allotted for time for questions. So
I think
good.
it's okay. I think we're okay still.
Yeah, I think we're good. So so I'm going to talk a little bit about the pharmacy landscape. The goal here is just to provide some context, to define some key terms and talk about how pharmacies interact with other parts of the healthcare system, and also to highlight some of the challenges that pharmacies face. And so I know we have a couple of pharmacists, and we're happy to have you here on our board. So this might be this will be old news to you, but bear with me. Next slide, please. So first of all, pharmacies play a crucial role in our healthcare system. As I'm sure all of you would agree, they dispense medications and other supplies that people need to recover from infections, viruses, and other illnesses. They offer accessible advice from licensed professionals on how to safely take medications. They provide vaccinations and other healthcare services, over-the-counter drugs, and healthcare products. And they help people to manage their chronic diseases such as diabetes, depression, and high blood pressure. And they're also important for when folks are discharged from the hospital and they need medications and supplies to continue to recover at home. A little bit more detail on the advice that pharmacists are able to provide. Pharmacists and pharmacy technicians can advise people on how to take both prescription medications and over-the-counter medications safely, including providing information on potential side effects that people might experience, drug interactions, and whether, for example, it's safe to take an over-the-counter cold medicine when you have high blood pressure. So they provide important pieces of advice for folks who are taking various medications. In Oregon, pharmacists are also able to initiate, modify, and continue drug therapy. They can also interpret and monitor lab tests. And they also have the ability through so-called collaborative practice agreements to collaborate with other healthcare providers. Next slide, please. So the most common kind of pharmacy is the retail pharmacy, which is the pharmacy that you can walk into down the street, and they dispense medications, other supplies, prescription meds, and over-the-counter medications. They provide healthcare services such as vaccinations. In Oregon, they have to be licensed by the Oregon Board of Pharmacy, and they are staffed by licensed pharmacists and pharmacy technicians. And there's some different numbers for this depending on what you look at, but there are approximately 500 retail pharmacy locations in Oregon, and this is based on data from 2022. And the next slide, please. So there's some other types of pharmacies that folks may or may not be aware of. I think online and mail order pharmacies on the right here, most of you are probably familiar with that. There's also something called specialty pharmacies, and specialty pharmacies are pharmacies that dispense specialty drugs. A specialty drug is defined in different ways. It can be a drug that requires special handling, distribution, or administration, where there's special requirements on data collection or other things, or where patients need extra support from a pharmacist or a healthcare provider to monitor side effects or other aspects of taking the drug. So those are sort of all reasons why a drug could be a specialty drug. There's really no universal list of specialty drugs. So one insurer may label one drug as a specialty drug, and another insurer may say, well, that's not a specialty drug. You don't need to go to a specialty pharmacy for that. So there's no kind of universal definition. And specialty pharmacies usually operate mostly kind of online and by mail order. They don't have that many physical locations. There are some, but not as much as retail pharmacies. They provide extra clinical support to patients, and many specialty pharmacies are owned or affiliated with pharmacy benefit managers, which are companies that manage prescription benefits for health insurers, and I'll talk more about those later. And online pharmacy, mail order pharmacy, I think you're pretty familiar, hopefully, with those. So I'm not going to spend much time on that, just other than to say that the term online and mail order seems to be used quite interchangeably. And again, just recapping that some specialty pharmacies are online pharmacies, so there's some overlap in sort of the use of these terms. Next slide, please. Okay, so this slide shows the results of a study that was published by GoodRx, which is an online pharmacy, back in 2021. And they did an analysis where they identified pharmacy deserts across the country. And this is a map showing the pharmacy deserts that they identified in Oregon. They defined a pharmacy desert as an area where most people have to drive more than 15 minutes to reach a pharmacy. And they found 11 Oregon counties that were pharmacy deserts. Next slide. Okay, the slide is meant to be a little bit, entertaining, but just wanting to talk about the prescription drug payment and supply chain, and the complexity of that system. There's a lot of relationships between different players, and it can be complex for certainly for folks like myself who work in health policy, but also folks that are pharmacists and are navigating this environment. So we put together some slides sort of trying to break this down a little bit. So I'm going to run through those. Next slide. So the first piece is just the patient interacting with the pharmacy. The patient visits the pharmacy with a prescription. Pharmacy dispenses drugs and collects payments from the patient. So those are things like co-payments, cost sharing, or other out-of-pocket costs that are based on the patient's insurance coverage. So this is assuming that the patient has insurance and is using that to pay for their prescription. And then next slide. So this shows how pharmacies get those drugs. Pharmacies purchase drugs from a wholesaler, and the wholesaler in turn purchases drugs from manufacturers. We're showing just one manufacturer here, but really wholesalers will work with multiple manufacturers and pharmaceutical companies to purchase drugs. And smaller pharmacy chains and independent pharmacies often band together in so-called group purchasing organizations. And they do that so that they can jointly purchase drugs from wholesalers and by doing so obtain lower prices than if they were purchasing and negotiating individually. Next slide, please. Okay, so here's where it gets a little hairy. So this is the relationship, showing the relationship between the insurance plan and the pharmacy benefit manager. Insurers generally contract with pharmacy benefit management company to provide a variety of services that manage the drug benefits for their plans. And so the services that they get from the pharmacy benefit manager include things like the pharmacy benefit manager will create a network of pharmacies where health plan members can use their plan benefits to get prescriptions filled. They will also develop a formulary or a list of prescription drugs that are covered under the health plan. This is also called a preferred drug list. And they work with pharmacies, so they will be the ones reimbursing pharmacies when they dispense drugs to plan members. And PBMs play a very central role in the supply chain and the payment system for prescription drugs in the US. They have a lot of influence on which drugs are covered by insurers. They can also require, in some cases, that members get their prescriptions filled at a specialty or a mail order pharmacy rather than going to a retail pharmacy. And sometimes that may be a specialty pharmacy that's owned by the PBM. There are 3 PBMs that control more than 3/4 of the market nationally. Those are CVS Health, Express Scripts, and Optum Rx. And all of those are owned or affiliated with insurance companies. And those insurance companies also own or are affiliated with specialty pharmacies. Next slide, please. Okay. So this just shows the contracting between pharmacies and pharmacy benefit managers. And so they reach an agreement with pharmacies to be a part of the insurance plan network. And then once the pharmacy is part of that network, when they dispense a drug to the health plan member, PBM will reimburse the pharmacy for the cost of the drug and a dispensing fee. A dispensing fee is supposed to cover the cost of running a pharmacy, and it's a fee that is paid every time a pharmacy fills a prescription. And so the amount of this reimbursement that they give to the pharmacy is defined in the contract between the PBM and the pharmacy. Independent pharmacies and smaller pharmacy chains may often contract jointly with PBMs by joining so-called Pharmacy Services Administrative Organizations, or PSAOs. Also want to mention here that because they are so large, PBMs manage benefits for so many people. They have a lot of leverage when they negotiate with pharmacies. And in many cases, even larger pharmacy chains may have to accept whatever rates the PBM is willing to offer, and may not be able to turn away and not be in the network, because they would lose such a large volume of customers if they were not in network with that PBM. And this has implications for access. If a pharmacy cuts ties with a large PBM, or a PBM says, we don't want you in our network, that means that people whose insurance use that PBM can no longer get their medications covered by insurance when they go to that pharmacy. One example of this is a couple of years ago, in December of 2022, Kroger ended its agreement with the PBM Express Scripts. And Express Scripts is the PBM for TRICARE, which provides benefits for military and service members and their families. So after this agreement between Kroger and Express Scripts ended, these beneficiaries of TRICARE were no longer able to go to Kroger pharmacies and get their prescriptions covered. And this is the final slide. I think next slide, please. So this just shows the negotiation between the pharmacy benefit manager and the manufacturer. So there's a negotiation that happens where the pharmacy benefit manager is creating this formulary and negotiates with the manufacturer for inclusion on that formulary. If the manufacturer, and then in return, the manufacturer pays rebates to the PBM to be placed in a favorable sort of tier on the formulary. Those rebates are then, part of those rebates are passed on to the insurance plan. And I think that's it for the prescription drug supply chain. So I'm going to move. Okay, I see some questions. Maybe we'll pause here. Annette, did you have a question?
Yeah, it's along this thread, but not directly involved. But I know one conversation that's come up pretty repeatedly over the past couple months, it has been related to payer systems and billing, particularly when it comes to pharmacies who use one particular company that was part of a that got hacked. And
Yeah.
so it would be interesting to hear that, they're getting off on a great foot and have some great plans. I think because that left a lot of people, particularly Medicare or other financially disadvantaged individuals, people on tight budgets, in a bad position where they weren't able to pick up meds for quite a while.
Thanks, Jeanette. Go ahead, Dan. And Dan, why don't you ask your question, and then I'm going to have a
Okay.
process suggestion. Go for it.
I actually don't have a question. I was just going to commend Jenny on a great job of parsing through an incredibly complicated and not very successful business problem.
Thanks,
Thank you,
Dan.
Thank you so much, Dan.
Yeah, I
hard
really
on this slide.
appreciate that. I'm gonna ask Jenny to get through the next few slides until, and we're gonna take a break, but I think she's gonna get through, Jenny, I think we talked about slide 44 before we take a 5-minute break or so, but you use your judgment. And so folks could just hold their questions, write them down. We still want them, but we really want to get through the information so that we have additional time for discussion. But so appreciate the questions. Don't lose them, hold them. Go for it, Jenny.
Thank you, Diana, and I promise I'm almost done, and I know this is a lot. So go to the next slide, please. So just talking about some trends affecting pharmacies in recent years. This shows the number of pharmacies with Oregon locations that closed in each year between 2013 and 2023. And we can see that in 2023, it's not super clear, but there were 36 pharmacies that closed in Oregon. If you compare that to prior to 2019, they were sort of less than 25 closing a year. So we're seeing an increase in the number of closures over time. And closures aren't just affecting independent pharmacies, although those are certainly being hit hard. There are also chain pharmacies that are increasingly reducing their footprint. Over the past few years, Walgreens, CVS, and Rite Aid have all announced that they were closing stores, and Rite Aid is currently undergoing bankruptcy. Next slide, please. Another trend that I wanted to highlight is the fact that independent pharmacies over the last 15 years, as I mentioned, are closing, are just increasingly being replaced by chain pharmacies. We've seen that between 2008 and 2022, there was a 64% decline in independent pharmacies in Oregon. So they went from being 248 pharmacies to only 90 pharmacies in 2022, while the number of chain pharmacies grew by 36% from 123 to 167. And we have seen similar trends at the national level. This is not just Oregon. Between 2010 and 2021, CVS and Walgreens acquired a total of nearly 5,000 pharmacy locations nationwide. And then the last slide. So third trend I wanted to highlight is staffing. And I'm sure the pharmacists on the board are very familiar, and this is happening across the healthcare system, but there's some severe staffing shortages affecting pharmacies, both in Oregon and nationally. This chart just shows the number of job postings for pharmacists and pharmacy technicians in Oregon, and the increase that we see over the last few years suggests some challenges in filling the prescriptions. We also, I'm sure you have all experienced or heard these challenges. Reports about staffing shortages have been widespread. There have been walkouts and reports of long waiting times at pharmacies. And I think that is my last slide. So I think, Diana, we might be ready for a break at this point, or
Jenny, I think you have through slide 44. So you have the
right.
consolidation slides.
Right, there you go.
Okay, wishful thinking. Okay, so I have few more slides. So, okay, so shifting gears a little bit about consolidation and what happens with consolidation when it affects, when it involves healthcare companies. So first, just defining, if we go to the next slide, consolidation is simply when two or more companies combine. This can occur through different types of business deal, merger such as this, acquisition, joint venture, partnership, affiliation. And in healthcare, consolidations happen all the time between different types of healthcare entities, including hospitals, health systems, insurers, clinics, pharmacies, and other companies that are involved in providing and delivering healthcare. And the next slide just has sort of a summary of some of the research on consolidation in healthcare. And just want folks to be aware that these findings are based on research involving hospitals, health systems, and physician practices mostly. So studies have found in those cases where there's consolidation involving those types of healthcare entities, that is often associated with higher prices, higher insurance premiums. The research has generally not found any improvements in quality or outcomes associated with consolidation. And also there's widespread research showing changes to services associated with consolidation. So things like changes in the services that are offered and locations of services, staffing, particularly affecting rural areas. And now I get to my last slide. So this is where the question came up earlier about Albertsons and Safeway, and I wanted to provide this kind of as a case study of what can happen after consolidation. So in 2015, Albertsons acquired Safeway. They were required by federal antitrust regulators to divest 146 stores to Hagen. Hagen was a regional grocery chain in the Pacific Northwest. And at the time, Hagen only had 18 stores when it purchased these 146 stores. Less than a year later, Hagen filed for bankruptcy, and it closed 127 stores and laid off thousands of workers. Generally, at a high level, Hagen lacked the infrastructure to rapidly expand into a national grocery store chain from just having had 18 stores. And they filed a lawsuit against Albertsons and Safeway, saying that they had tried to undermine Hagen as a viable competitor. That lawsuit was eventually settled, and Albertsons ended up buying back 48 of the divested stores, in addition to some of the original Hagen stores. So they essentially, now Hagen became one of Albertsons' store banners. So this is widely discussed and has been brought up in the context of this current merger as well. U.S. Senator Ron Wyden wrote a letter to the FTC in December of last year, noting that as a result of the Hagen bankruptcy, dozens of pharmacies had closed in Oregon. And yeah, so again, highlighting this because there are similarities, at least superficially, between this and the current transaction. They both involve grocery stores that have pharmacies. They both involve divestitures, and they both have impact or locations in Oregon. And again, as I think I mentioned, the FCC has mentioned this as sort of an example of what can go wrong, what potentially could go wrong for this particular merger as well. And there's concerns around this track record. So I think that's my last slide. Finally, and
we're gonna take a break. The next slide, just to foreshadow for folks, is we're gonna hear from I think Jenny and or Stacy about some sort of data information about how might the transaction impact Oregon. Once we get through that, we'll be and there's only a few slides there. We'll be having some time for questions and discussion. So take 5 minutes. Come back at 2:50, everybody. It's about 2:45 right now. So 2:50, we will reconvene. Back by raising your hand or something. We'll give it's just 2:50. So just want to get everybody back. Hey, folks. Okay, so give me a thumbs up or camera on or some way to let me know that you're back. Okay, great. Okay, I think we have just about everybody. Got it. Okay, so we're going to continue these next few slides, and then we're going to get to sort of and we've already been capturing questions and your comments, but then we'll have sort of some concentrated time. So go ahead, Jenny.
okay. So just want to tee up the discussion a little bit with sharing some insights or some information and key data points from OHA's analysis to date. So if we go to the next slide, this shows a map of Kroger and Albertsons pharmacies in Oregon. Kroger and Albertsons, as I mentioned, currently operate 159 pharmacies in Oregon, and those pharmacies together dispense more than 11 million prescriptions annually, which is about a third of the state total. They serve approximately 400,000 customers annually, which is nearly half of people in Oregon who obtain prescriptions based on OHA's analysis. And they also generate revenues for prescription sales of about 700 million per year. And you can see on this map, you've got the Kroger in blue, which includes Fred Meyer, QFC, and then Albertsons in green, which includes Albertsons and Safeway stores or pharmacies. We can go to the next slide. So we also looked at what would happen to competition, specifically market share, as a result of this transaction. So the combination of Kroger and Albertsons would lead to a company that would dominate Oregon's retail prescription drug market. Even with the planned divestiture to CNS, the combined Kroger and Albertsons would dispense 28% of retail prescriptions statewide. The next closest competitor would dispense 15% of prescriptions in the state. And CNS, based on historical data, would capture about 7% of the market. So this is at the state level. We also have done analysis at the local level, looking at service areas around pharmacies. And there are many local areas of the state that are both served by Kroger and Albertsons pharmacies. We found in our analysis that many of those areas, a total of 38 service areas, the transaction would increase Kroger and Albertsons market share such that based on federal guidelines, the transaction would be expected to have anti-competitive effects in those areas. And I'm happy to share more about that analysis if folks are interested, but I'm going to move on to the next slide. So on the CNS front, CNS is planning to purchase around 50 grocery stores in Oregon, and they will have the rights to the QFC banner. These are some statements that they have made about what their plans are. They're saying that they plan to invest necessary resources to maintain pharmacy and prescription drug services, and they will continue to recognize the union workforce and retain frontline employees and further investing for growth. So they, as I alluded to earlier, they have not provided detailed operating plans for their operations of the divested stores in Oregon. Sort of following on from that, if we go to the next slide, just want to run through some questions that OHA has asked for. We've asked for a number of pieces of information from CNS on what their plans are, including the plans for hiring pharmacists and pharmacy technicians in Oregon, their plans for obtaining licenses and other approvals for pharmacies in Oregon, whether the divested pharmacies would continue to participate in the same insurance plan networks, and how CNS will obtain drugs from wholesalers. And also just generally asking them what the potential impacts can be, what would be on the range of drugs that are offered at pharmacies and the services that they're able to provide at the divested pharmacies. So this was all part of an information request that we sent back in December of last year. We have not received a response to that. If we go to the next slide, this relates to what will happen with Kroger, the pharmacies that Kroger is taking over from Albertsons. They will own 127 grocery stores in Oregon and at least 110 pharmacies. They have said, as I think I mentioned earlier, that they don't have any plans to change pharmacy operations. They have no plans to change product, services, the number of pharmacies they are operating, the types of insurance, the number of pharmacy employees, the levels of pharmacist prescribing, or the levels of dispensing of contraceptives at their pharmacies. And I just want to highlight here that we have not received confirmation from them on the types of insurance accepted. We have asked about the fact that Kroger currently is no longer in network with Express Scripts, so they don't accept TRICARE insurance, whereas Albertsons and Safeway are. You know, we have not received a confirmation if Albertsons stores and Safeway stores will continue to be in network for TRICARE, and that's a question that is still that we're looking to get answered. And that is the end, I think, of where I want to. I know that was a lot, and I'm going to hand it over to Diana.
Yeah, so thank you, Jenny. I know that was a lot and you did a great job. Thank you. So here's really how we want to spend the next 25 minutes with you or so. And we've already started collecting questions, but I want to show this slide to you, and then I want to skip ahead to another slide. We're just going to sort of combine them. But really what we want you as a group right now to think about is, what are the things that this is raising for you? What are the questions? What potential, if any, impacts might you see? And that this conversation, and again, you already started going there, would lead to thinking about the questions for the public hearing. Or you might have questions, just as you already did, and OHA might say, oh, we can bring that to you. Or we, you know, that, like the equity impact, for example. So want you to be thinking about these questions, sort of what you've heard so far, what questions are those raising for you, whether it you know, the number of retail pharmacies to insurance plans, out-of-pocket costs, equity considerations. And so if we just go ahead a couple of slides, please, to slide 51. Yeah, so it's really these questions that want to open the floor. And again, we've captured some already. Want to hear from all of you about this. And the last thing I'll do is just want to share a little bit about process. So what we're going to do is we're collecting these questions from the Community Review Board. We will, you know, we're thinking at the public hearing that there's probably time for about 6 to 8 questions. We think we can consolidate, you know, we want to hear all the questions you have, right, at this moment. the staff will take some time in the next couple of days, organize this, your questions that you pose, get it back to you by probably Friday, have you all look at it, have a little more time to sort of contemplate, get that back from you. And this will be in an email by like Monday, late day Monday. And because there's the set of questions that you all have will go to the entities by April 17th or so. So we want to provide a process right now for you all to ask questions, but also know that you're going to have some time in the next few days. Also, we can be thinking about, not only are there some questions the health authority may have answers to, or, or might have some ideas that they will share back with you. Also, there might be questions to ask in the public hearing, and there might be questions that are better asked and answered in writing. So the staff will do some of that sorting, get that back to you for responses. So right now, really want to just ask you, and you had, a number of you had sort of teed up some questions around, is there, whether it be something like, is there a list of stores that will be sold, or the criteria? How might the divestitures impact equity? I think there was a question about CNS, how might prices be impacted? How might it impact tribes? Kroger, if Kroger is saying they won't close stores, for how many years is that hold true? So we've just been, those are some of the ones we've captured. So I'm going to open it up to the CRB to help us for you all to pose the questions, the issues that are on your mind. So I'll start with Dan, and then we'll go to Jeanette.
Okay, so my question, it's a bit in the weeds, and I'm sorry, but I'm curious which company, which entity will be responsible for everyday pharmacy operations, seeing as how they have different software that they use to process prescriptions. They have different online tools to work within their stores. So, Albertson Safeway, their operations are significantly different than Kroger, and CNS sounds like they don't really have any experience in it. So I'm wondering if that's going to be centralized, or are we going to have to deal with 3 separate entities doing pharmacy operations?
Thanks so much, Dan. Jeanette.
So my question is also a little in the weeds, but I think as there's been a conversation at the national level about, and it came up here today as well, about the changes that have allowed both behind the counter birth control access and then over the counter birth control access. If we are seeing changes in pharmacy access, what that is going to look like on a much bigger scale, particularly when we're considering people who might not have insurance, and who, that is a pretty vital service for them, and what that impact is going to look like.
Got it. Thank you, Jeanette. David.
Thank you. My question is to OHA about the timeline for companies like CNS to respond. I understand they haven't responded. Is there a deadline for them to respond? Is there any kind of requirement for them to respond? I would be curious to see that operating agreement as it relates to, just the overall operation plan, going from 23 stores nationwide to owning 50 alone in Oregon and having no pharmaceutical background. With these 50 stores, I assume all of them would have a pharmacy component. So I'd be curious about just the response and timeline to kind of get that information from CNS, if there is a requirement, or if they would just kind of stay silent and see how this thing shakes out. And then as I'm thinking about the Hagans, I would be curious to ask Kroger-Albertsons, since Albertsons had a little experience with the Hagans deal, Safeway Albertsons, just what because it does look very similar, not exactly apples to apples, but very similar situation with Hagan having 18 stores and lacking the infrastructure to expand. It seems like CNS stores as a wholesale grocery would be similar, a very similar scenario. So what about this deal that would provide some assurances that this would have a different outcome that would result as a benefit to the communities, especially the rural communities? I think, as I'm thinking about communities like where I live and where I have cousins and family in rural parts of Oregon, just that consolidation, it is true that it results in staffing shortages, higher prices, shortages in staffing and services. And yes, that's kind of where all my thoughts are right now. But those questions specifically for CNS and the Hagans relations.
Thank you. So Jenny, Stacy, do you want to respond to David's first question about response timeline for the entities?
Yeah, I can address that. As I noted, we requested the information in December, and we did not provide a deadline for them to provide that information. The way that our review works is that we pause our clock until we get that information. So if we don't have that information, that's going to be an issue for us to be able to complete our review and for them to be able to close the transaction. So I think, they're incentivized to provide that information to us. I think we have ways that we can potentially, put some pressure on the entities to give us more information sooner. And I think the CRB is one such mechanism that if a question is coming from CRB members in a public hearing, there may be opportunities for them to provide more information in that context.
Great. Alyssa.
I wasn't clear, and maybe I missed this, but the CNS employees that work at the stores that are being divested, what happens to them?
I'll just clarify and then probably hand it to Jenny. So the CNS is purchasing the divested stores.
The Kroger-Albertsons stores that go to CNS, what happens to those employees? Sorry.
Yeah, Jenny, can you speak to any commitments that CNS has made related to employees?
I think I went through those in the slides that they have said that they are going to continue to recognize the union workforce, and they are committed to retaining frontline employees and further investing for growth. So those are the statements that they have made publicly about that. And I don't have additional information that I can share on that.
Okay, because I saw something too about hiring pharmacists and pharmacy techs, but I mean, really, they should get a bunch of those coming over, right?
Alyssa, that's a question we can add for sure.
Okay.
Yeah.
Okay. And then maybe this is more a Stacey and Jenny question, but are you guys having similar conversations like this with PBMs and large employers in the state, insurance companies? Because I have to think that they're doing a lot of their own data analysis on, top claims paid and, things like that they would have other questions. Are you guys having conversations with them in other forums?
We are not in this, and not in context of HICMO's review. Obviously, OHA has other initiatives and programs that relate to PBMs and prescription drug pricing. So, but in terms of our review, we have talked to folks internally at OHA who are part of our pharmacy kind of group, if you will, and that are have expertise in those areas. So that's sort of what we've done in terms of the PBM piece, but we haven't talked to directly with any PBM as part of a review.
Okay, and I'm sure that the pricing, I mean, depending on what happens with the PBM and contracting and all that stuff, it would all change anyway. But I have to think that a lot of these large employers like PEB and Regents have probably ran through their claims like top 50 or 100 and said, if we price these were paid at Kroger. If they ran through Albertsons, this is what the cost difference would be, right? On the copay side for the members and then also on the plan side. Do we have anything like that, or is that not really worth looking at because that could all change with PBM contracting and all that stuff?
Yeah, we don't have anything to share on that. I think our understanding is that sort of our preliminary kind of exploration of potential price changes. I think it's difficult to assess what will happen with prices. There's certain because of the complexity of the supply chain and the way that reimbursement works with PBMs and pharmacies. We are not. It's difficult to say really what the ultimate impact could be. I mean, you think about Kroger and Albertsons potentially being able to have more leverage in negotiating with PBMs and maybe getting better reimbursement rates. You think about maybe them being able to purchase drugs at a lower price because they're bigger, they have more volume. Those are some things, but in terms of the ultimate impact on prices, it's very difficult to assess that.
Okay. And then the only other thing is just generics, looking to see if there's a way to compare, because I know there can be a lot of disruption there if someone has to change pharmacies and it's a different generic.
Yeah, no, that's not something that we've looked at, but it's a really great point.
One thing I wanted to follow up on your last question, Alyssa, just to clarify, and I'm not sure if this is helpful, but I just wanted to state that we do have access to Oregon's all-payer claims database. So we have access to prescription claims data. While we're not talking directly with PBMs, those data are submitted by, they have information for people who have prescriptions for different insurance plans in the state. So that's a data source that we're drawing from to get at some of these analyses.
I know there's so much repricing analysis that happens with like potential moves to PBMs and insurers and things like that. I just don't know, given all the things it could change, if how much it's worth looking at those things. So, or what's worth looking at.
Yeah, and Alyssa, that's exactly like these are the kind of ideas and questions we want to generate. And then to your point, we can sort of finesse and hone and say, is this the right question for the public hearing? Is this a written question? Or is this something that is such an unknown that you all might want to hold off on? But exactly the kind of questions to generate.
Okay, thank you.
Let's go to Craig, then Kevin, then Jeanette. Craig.
Thank you. This is almost the exact same question as David had, but it caught my ear when Jenny was talking. I made a note of it, that CNS had gotten that letter, or at least mailed to them in December of 2023. And as of this month, they had not answered the questions. So this leads me to my question. Okay, so I printed this letter here from Sarah Bartleman to the 3 entities. And it says here that all individuals appearing on behalf of Kroger, Albertsons, CNS must respond by April 9th. Do we know if any or all 3 of the entities have responded in agreeing to appear before us?
They have not provided, to my knowledge, in case something came in during this meeting, they have not thus far provided the names of representatives.
Yeah, I was just concerned because it just seems kind of unprofessional of CNS to have had going on 4 months or whatever, 3.5, 4 months, not to respond. I know it's a very detailed question and kind of a boring one, but it concerns me that they don't show the professionalism to at least send a 1-paragraph response. But anyway, thank you.
Yeah, I can add that I think Stacy mentioned we did have a meeting with them this week to talk about the public hearing and how that kind of would work. And they asked to have a little bit more time to, we talked to our program usually interacts with the attorneys that represent these companies. So we talked to their attorneys, and their attorneys are going to go talk to their clients and relay the information to them. So they did ask for some more time to determine who would be the most appropriate person. They asked for, what types of what level of detail will you be asking questions so that we can select the right person to be at this hearing. So we did agree to that. So I'm hoping that we will get those names by the end of this week. But as of yet, we don't know.
Okay, thank you.
Kevin,
Yeah, I mean, I don't know if probably somebody else has already addressed this a little bit. I just wanted to kind of reiterate and add some thoughts about, like, I feel like one of the big concerns that came across to me from like public comments and what people are bringing up here is, how are this transaction going to affect communities that are smaller, that maybe have already had closures of pharmacies like Bi-Mart, right? It has recently closed stores, a lot of independents, which you touched on, and just how they can reassure us that a company like CNS is going to be able to manage pharmacies and will be there for the future, and how that's going to improve pharmacy services and healthcare for Oregonians. I think that's a really key question. I don't feel like the quotes that I've seen in the presentation, I don't know if there's more details than what they presented already, really hit that. The other thing that I would find, concerning is that, the fact that it's going to be the largest pharmacy company in the state. That seems to me like it's going to put a lot of pressure on even more pressure on independent pharmacies or smaller companies that are already struggling, just in the fact that they're going to have another bigger player that can probably do, lower prices or have contracting, resources that these smaller players don't have. I like at the pharmacy I know, like you mentioned in the very beginning, Kroger has their own PBM, and I think occasionally we get Kroger patients that come through just probably because of convenience. They don't necessarily live close to Fred Meyer, so they probably prefer to fill in a small town. Like I know with some of the companies, CVS, Caremark is the largest PBM in the country, and that there's oftentimes steering towards mail order and different services like that. So what would stop they have their employees or whatnot from steering people to their preferred pharmacies? Yeah, I mean, just and how I think that in terms of like what group I feel like this might affect the most, especially if there are closures, is going to be the elderly population. I go to towns like Sheridan, Oregon. They have one pharmacy. It's called Sheridan Pharmacy. It's technically part of High School Pharmacy, but it's still has their original independent name because that's how a lot of our pharmacies became part of High School Pharmacy. There's the normal pharmacist there doesn't vaccinate. So when I come there, I only go there every other Saturday. Like when we're in flu season, COVID vaccination season, I am running my tail off to do vaccinations. And so if somehow there was this, there's no Fred Meyer or Albertsons all that close, but if it for some reason this affected that store and closed, a lot of those people can't drive. They need somebody to take them to the pharmacy, potentially elderly patients. And that's, even in bigger towns, because that's just a population that needs a lot of pharmacy services and is also probably oftentimes has difficulty getting to pharmacies in the first place. So I just want to leave it at that. I don't know that I really have any specific question there, but it's just some things that I was thinking about as we were going through this.
Kevin, super helpful. And you cut out a little bit here and there, but I just want to be sure that I'm reflecting back what I heard, which is how might this, and your thoughts about how might this transaction impact smaller communities and communities where they've already seen closures, and what happens to some of those smaller entities, especially, that are serving these rural communities and where there's especially high numbers of elderly populations. What is the sort of lifting up a concern about that?
Yeah,
So
I
I just
mean,
wanted to make sure I got that.
can you hear me okay? I switched to my
Yeah.
headphones because I have somebody
Yeah,
else
you're
in the
good.
room. So it's probably why I'm cutting out. But yeah, I mean, just looking at some of the public comments, and so we actually have a pharmacy associated with us in Florence, Oregon, too, Florence Pharmacy, which I don't go to that often, but I've been there a few times. And it's another community that, they lost a Bimart. I think recently they lost a Rite Aid. There's a Safeway and a Fred Meyer, and it was in some of the public comments that have already been submitted that people are concerned that one of those stores might close. Probably the Safeway. And so then they'd be down to like 2 pharmacies. It's a
Right.
community that has lots of elderly people because it's on the coast. It's a nice place to retire. So, you get to a point where even if they add staff, there's only so much you can do with the resources. If you go from 5 pharmacies to 2 pharmacies, these stores are only so big. You can't just keep adding people to take that up. Space, you need space for that too. You need space to store drugs, space
So-
to give vaccinations. So there's just a lot of things that I think
Good.
really
No.
need to be looked at that, especially if closures happen, which
Yes.
based on the track record seems like is probably going to happen, with CNS, the divested pharmacies.
Good.
So
We will
at least in
definitely,
my mind.
yes. So we'll make sure to add that set of questions as well. So thank you. I want to go to Jeanette, because we just have about 10 more minutes or so. So I want to go to Jeanette and if think about your other questions, folks, and again, you'll have this other opportunity, but go for it, Jeanette.
Yeah, so I just want to piggyback that what was just said. I live in a very small rural community where we, within the last year and a half, went through a closure of a pharmacy, and it has put our community in a tailspin. Truly paralyzed our community, and there's rumors that we're going to lose another pharmacy. So. And to add to it, it's not so the elderly is one big population, but the community I live in has a very strong group home presence as well. And that is another population, individuals with disabilities, who may not be able to drive and, have a wide variety of health insurances. And so that is going to be a challenge on multiple fronts. But my other question was just we don't have to plan it all out here, but it would be helpful to know what the transition process is going to look like if this merger goes through, so that people know if my store's closing, I need to plan 3 months out, or if my store's staying open, but my insurance won't be accepted anymore. You know what I'm like, you understand all the scope of problems that could come up, just so that people who are impacted have an understanding of how early out they should be planning for
and
their
Jeanette,
next step.
and that can certainly be a question, right? Whether it's inviting public hearing, right? So what is the transition process? So great question. Let's go. We're going to go Craig, David, and Laura. Craig.
Thank you. Okay, I'll be as quick as I can. I want to be one of those students that the other students hate. I want to say this before we shut down. I really like, Diana, how you run the meetings. You're very personable, easy to ask questions. And I want to and say nice things about Stacy and Jenny. How the meetings are. I like how we're flowing here. And I want to just say one other compliment. I really like how you sent us the slides. There's so much information. It's a tidal wave, and I keep referring. I have a window open here, and I go back and I look at the slides. I try and take notes, but I really appreciate if you could continue to do that. Send me the slides. I open them in a window next to our meeting, and I can read them. Sometimes they move so fast, but anyway, that was it. Thank you.
Craig, thank you. And also want to appreciate that as we shared with all of you, this is the first CRB. So that kind of feedback and the process throughout, we welcome. So appreciate that. Let's go to David.
Thank you. I think one question that might be pertinent is to understand what was the process from Kroger, what was Kroger's process in determining CNS as a viable partner or a viable competitor, I guess, to sell these stores off. So I would be curious about what their process was, since it's, they don't have any pharmacy background, and curious what was the decision-making process of why they identified CNS as the benefiter.
Thank you. Laura.
Sorry. This is kind of a broader question, I guess, but I mean, it seems to me that, right, they're going to make promises. They're going to say they're going to keep all the stores open. So even if we ask them, are you going to close stores? They're going to say no, right? So I guess I'm trying to figure out, are there any kind of binding things that they could put into place, or that the government, we or as OHA or others could put into place that would actually protect consumers? Or is it really like what happened before, where they said, yep, we're not going to close anything, and then 5 seconds later, all those stores are closed, and Albertson bought a whole bunch back and they settled the lawsuit? And it just feels to me like once these deals are done, there's very little ability to really enforce anything that they promised. So I'm just curious if OHA has thoughts on that, or I mean, maybe not for right now, but just want to throw that out there.
Sorry, Jenny, do you just want to remind folks like how the approval can be and what the CRB can do as well? Or Stacy, either one of you.
Yeah. So as we talked about earlier, OHA has the ability to, if a transaction is approved, to approve it with conditions, and those conditions can be exactly, we have in the past for other transactions, we've imposed conditions that were based off of those commitments that have been made, that no services are going to be reduced, and all the doctors are going to keep providing the same services, so forth. So those kinds of things can be certainly can be included as conditions, and we'd love to hear from you all on what if there are conditions that would be helpful, what those would be, and how those might be formulated.
Yeah, I think my question is more like, if they do violate those, what happens? I guess I know we can place them, but is that
does
the
that go to
AG can
DCPS?
prosecute them, or what happens if they violate them? I guess.
Yeah.
We can follow up. I think we can follow up to provide more information, but we do have some recourse. There's legal recourse. We can assess civil penalties. But I think we can go back and talk to our legal team and put something together that's a better response than that for you.
So Dan, did you have a comment?
I was just going to say, would the enforcement level come from DCBS possibly? Department of Consumer and Business Services? Are they going to sort of have the overall umbrella for this?
DCBS will not have the overall authority for this. So this is an OHA transaction. For some transactions, OHA is making a recommendation to DCBS, and those are transactions where there's an insurance carrier involved. So for this one, the enforcement of a HICMO decision would be with OHA, and we would partner with the Department of Justice.
Okay. I also wanted to just make a quick comment that the majority of pharmacy patients now have some sort of insurance or third-party payer. So when we're talking about price differences, those should be pretty minimal, because right now you should get the same price for your medications at Kroger or Albertsons, because it goes through the same PBM and they should be charging the same regardless. So I think last time I heard Oregonian patients have approximately 95% insurance penetration. So we're talking about a very tiny percentage of individuals that would be paying cash out of pocket. It just doesn't happen very much anymore.
Yeah.
So,
Thanks. Thank
Yeah.
you, Dan.
and
So-
thirdly, I'm just grateful to find out that CNS doesn't stand for Central Nervous System. That's actually the name of a company. Thank you for that. I was a little confused after the last meeting, so.
Okay, thank you. So we are just about at time. So just to remind folks, next steps is we're going to take all these questions and comments that you've given us. Jenny and Stacy are going to look at sort of how do we combine if we don't, to have sort of 6 to 8 questions or so for that public hearing. And just to go to the last slide, so that public hearing is coming up on the 24th. So we have a couple of weeks, but again, we want to get those questions to the entities by the 17th. So there will be, Jenny and Stacy will send some like consolidated list to all of you. You'll have time to to provide some response, say, this sounds great. Could we also ask this? Could we add this to this question? That kind of thing. And don't forget, there are some questions, the health authority may already have information that they can share, and there may be some questions that might just be more efficiently answered in writing. And the other thing I want to remind folks of, if you are interested in just providing some of those brief like a welcome at the public hearing and, brief introductory remarks, again, you'll have talking points. There will be a slide. It'll be pretty straightforward. Please let Jenny and Stacy know you're interested. And again, if there's more than one person, we'll just pick it out of a hat. But we think it's really feels important. This is your hearing. And even though the health authority is asking the questions for a variety of reasons, it just makes sense to have you all, one of you introduce it. So we're going to wrap up. Thank you. We will, do not hesitate to reach out. We are here for your questions as we get ready for that public hearing, and then we'll have meetings after. So it's just the next thing on our calendar. Thank you everybody so much for your great participation. A big thanks to Stacy and Jenny too for putting together all that information, and continue please to give us feedback to help us work with you as best we can. Have a great afternoon, everybody. Take care. Bye.
Bye.